A New Hampshire emergency room doctor with 3 decades of experience is sharing what he learned about treating coronavirus patients with potentially dangerous cases of pneumonia. In a New York Times op-ed, Dr. Richard Levitan described his 10 days volunteering last month at New York's Bellevue Hospital. He wrote about the simple technology that he believes could save lives. We spoke with Dr. Levitan yesterday, who told me he was very surprised by what he saw in the ER.
People were sick for days, and then they only came in with shortness of breath like the day they presented. And they would arrive with oxygen levels that basically were incredible to us. I mean, almost unimaginable how people could be awake and alert and have oxygen levels that are half normal. You know, normally we are 94 to 100% on these devices, these pulse oximeters that measure how much oxygen we have in our blood. And people were showing up with oxygen levels of 50%. Now, this matches the level of oxygen that we've measured on the summit of Mount Everest.
Wow.
And it's amazing to me that patients could be sick for days, getting sicker, not realizing it.
So they had these very low oxygen levels, but they had no sensation of, I can't breathe. Is that the point
Yeah.
you're making?
Exactly.
You were surprised that some of them were still talking on cell phones. Why is that significant?
You know, what is amazing to me with this disease is people's brains are working fine. Their oxygen levels have gone down to scary low levels, but it has happened slow enough that their body has accommodated it. So they are not like every other patient we see with serious lung disease. But what I'm saying is this disease kills by silent hypoxia. And patients should understand that shortness of breath is a late sign.
Hypoxia is what exactly?
Is low oxygen.
And the reason why it's so important to get this early warning is because it could avoid you being on a ventilator and having to be intubated, right?
Absolutely. So, you know, we think this pneumonia basically has two phases. This silent hypoxia period where the oxygen's drifting down, but you feel okay. And then the second part of this disease, the part of this disease that kills, is when all of a sudden your lungs get stiff, carbon dioxide finally starts to build up, you begin to feel short of breath, and those patients are the patients who are presenting with COVID pneumonia.
By then, in some cases, it's too late. By the time you go to the hospital and you can't breathe, it's a very serious, often dire situation.
Yeah, but let me just reassure people that what the lessons learned in New York are that we don't have to put in breathing tubes, even in most of the people who show up with advanced COVID pneumonia.
We don't.
What we learned, no, they did a study of 50 patients. And what we learned is that even people who showed up with significant COVID pneumonia, we could keep off of ventilators, 3 out of 4 of them. So 75% of patients didn't need ventilators, but they needed oxygen. They needed to do what we call positioning maneuvers. So we put them in different positions to help open up areas of their lungs.
How do you know, Dr. Levitan, when you should even check your oxygen levels?
Let's talk about Germany. The Germans have the lowest death rates in Europe. What they do is every patient who has COVID, they visit every day and they check their oxygen and they check their vital signs. And so what I'm saying to you is, if you're having symptoms of viral illness, if you're known to have COVID, you should be checking your oxygen. If you don't have an oximeter, increased breathing may be a sign of that, but also just feeling worse.
Most people listening to you will now think, I need to get an oximeter. Can you explain exactly what that is and how it works?
Basically, you know, you just turn this little button on and you put it on your finger, and within about 10 seconds or so, it displays your heart rate and your oxygen level. I think that oximeters in the midst of a respiratory pandemic and for the next 12 to 24 months, that the public should think of an oximeter the way they do a thermometer. It is a tool that they can have at their home, that they can check, and that they can call up their doctor and say, hey, my pulse oximeter is reading consistently at this number. Is that something I need to be concerned about?
I think every day we're learning something new about this COVID-19. And it seems to be such a moving target, always changing.
You know, what I'm telling you is actually hopeful. What we are learning about this disease is it attacks primarily through one pathway, and that's the lungs. We know when it is going to attack. It is going to attack between 5 to 10 days after infection. And we know we have a way to detect it earlier. And that way is by close monitoring of pulse oximetry. And what I'm saying to you is that as the public health messaging shifts, we can move the treatment curve earlier and do much better for patients.
Oh, the thing about Dr. Levitan, I learned so much talking to him yesterday because his whole thing is I'm not trying to be an alarmist. I'm not an alarmist. This is actually offering hope. And when he explained it to me in great detail, I see what he's saying. He believes many people are put on ventilators that may not have to go on a ventilator if doctors rather had just given them the oxygen that they needed. So I thought that was very fascinating. And oximeters, by the way, are not expensive. You can get them at the drugstore.
Yeah, Gayle, it's very interesting stuff. I mean, this is a new virus. We're a complex organism, but what this comes down to, according to the doctor, is something quite simple. We need oxygen. We need air.
Yes.
And I love that simple fix. An oximeter. I'll be Googling that later today. Really eye-opening interview. Thank you.
Yeah, I know. You should have seen me, Tony. I got off the interview with him and went right to the internet. Yeah. He's not saying that's always a problem, but that is something that we should start looking at more carefully.